Good afternoon, everyone. Thank you for joining us today for this Facebook Live on heart health during the COVID-19 pandemic. As you may know, February is Heart Month, so it was the perfect time to bring back Dr. Kirk Garratt, our medical director of ChristianaCare's Center for Heart and Vascular Health. Dr. Garratt, thank you for joining us today.
Hey, it's great to be with you again, Megan.
So we last spoke a few months ago. What has changed since the fall when it comes to heart health and COVID? What is new?
Well, I think since our last conversation, the attention has really pivoted to the more long-term consequences of COVID infection. The acute effects are disastrous enough, of course, but we're learning, sadly, that for some patients, there can be durable and lasting effects, both in the lungs, in the blood vascular system, and in the heart. We don't have a complete understanding of how the heart is impacted yet by COVID, despite a year's experience with this terrible germ. But we do understand that sometimes the germ will affect the heart muscle directly, sometimes it affects the structures around the heart, and sometimes it affects the blood vessels and the blood clotting system in such a way that blood vessels might clot off, including blood vessels feeding heart muscle. All of those things can lead to injury to the heart structure in such a way that it can't work as a pump as effectively as it had in the past. Happily, most people recover from the acute illness, or at least many people recover from the acute illness when it affects the heart. And we had been optimistic that people would just slowly get over it and it would all be behind them. We think that that will be true for many patients, but it does appear that there's a risk. Some people will have lingering impact on heart function, and we're not sure how long that may be an issue for them. Those lingering problems can include difficulty with exercise tolerance, difficulty with irregular heart rhythms, even problems with congestive heart failure. So even though it does look like we've come a good long way with this pandemic, and with the vaccines present now, we're optimistic that we'll be able to see our way to the end of it soon. We unfortunately have yet a ways to go to completely get through the consequences of this pandemic.
So with all of those possible side effects, for lack of a better term, of getting COVID, would you say that heart patients are at even higher risk then if they were to get COVID already having those heart conditions?
Well, we do know that people who have pre-existing heart problems, even pre-existing conditions that we know tend to lead to heart problems, are at greater risk of having a bad outcome if they get sick with COVID-19. There's been a lot of attention paid to hypertension in this regard. Hypertension surfaced at an early point as a characteristic of people who had a particularly difficult time getting through COVID-19. And you know, Megan, hypertension is extremely common in America.
Mm-hmm.
And particularly once you're over the age of 55 or so, your probability of having some blood pressure trouble is very high. And so it's sadly been true that large number of people who have hypertension exist at higher risk of having consequences from COVID-19 infection. And as mentioned, those can include long-term consequences.
So if someone's watching right now and has hypertension, what would you say to them?
Well, I would say two things. First of all, aside from the COVID-19 pandemic, hypertension has been called the silent killer for many, many years, and it's because it's true. Hypertension contributes to so many different cardiovascular problems and ailments, including irregular heart rhythms, heart attacks, strokes, heart failure. If we could just get ahead of hypertension, we would see the incidence of those sort of problems and all the misery that they create fall sharply. For that reason, ChristianaCare has taken a renewed focus, has renewed its focus on hypertension management. We now have declared hypertension management as one of our large organizational objectives. I can tell you without exaggeration that I literally spend some part of every day in conversation about how we can work better as an organization to control blood pressure in our community. Now, with regard to the COVID-19 pandemic specifically, if you have hypertension, that should just be additional motivation to do all those things that we've been hearing about over and over now for months, that are simple to do, but hard to execute sometimes.
Mm-hmm.
Wear the mask, please. Wear the mask. Wash your hands, please. Avoid touching your face and nose and eyes and mouth. Stay distanced from people. Don't go into crowds. And by the way, even though the vaccine is nigh, we will soon have it in our community widely, there is still much to be discovered about how functional this vaccine is in providing perfect protection. 90% effectiveness of a vaccine is amazing. We've had very few vaccines prove so successful. Mm-hmm. But we don't know if that means that you can't get infected. In fact, we would say 10% of people we would think will still get infected if exposed to COVID-19 despite their vaccination. We also don't know what the consequences will be for those folks. We certainly hope that the vaccine will prevent them from getting terribly sick with COVID-19 and hopefully prevent them from having long-term consequences like these cardiovascular issues as a result of their infection. But we don't know that with certainty yet. We're still too new in the experience to be sure. So if you have hypertension, if you have diabetes or high cholesterol and or have extra weight, those should all be strong additional motivators to do what you need to do to stay safe.
So you mentioned the vaccine. Let's back up a little bit to the vaccine as a whole. I think there are some heart patients watching who may be asking if they should get it at all, or how important it is for them as a heart patient to get the vaccine when it is available to them specifically.
I know that this has been a difficult conversation because the vaccine happened in such an unusual way. People appropriately have questions. Was this done correctly? Did we cut corners? Are we sure it's safe? And believe me, experts who are far more informed about this than me have said repeatedly, and I've looked at the data and can affirm that what they're telling us is true, that the vaccine has proved to be both effective and safe. I just read another article here this morning about a vaccine, another mRNA vaccine. Again, high efficacy, no worrisome signal of safety concern. So if you have heart and vascular disease, right now, the most important thing you can do is stay in care, stay connected to your healthcare providers. The second most important thing you can do is make sure you're in queue to get your vaccine at the earliest time possible. You have special risk of having a terrible outcome if you get sick. We do trust that these vaccines will help keep you safe. Not perfect, don't have any perfect medicines to offer, but this one's really, really good. And all the indicators are that despite your having heart and vascular disease, you can receive this vaccine with complete assurance of safety.
Absolutely. And you mentioned staying connected to care. How important is it that everyone, not even heart patients, are continuing to stay connected with their physicians during this time?
Well, we have been saying through the pandemic that we don't want people with chronic disorders of any kind to stop coming to see their care providers. As most people know, ChristianaCare, we worked quickly to expand out our telehealth services, our virtual medicine platform, to make it easier for people to stay connected to their healthcare providers despite the pandemic. But even for those people who said, golly, that's not for me, I want to come into the office, but I'm not sure I want to go to an office where there could be COVID patients. We worked very hard to assure processes were established quickly that would keep people like that safe. Allow space, allow a process whereby they could see their healthcare provider eye to eye if that was their wish, and not have undue concern about getting infected. And a lot of that involved things that have now become familiar to us, assuring that there's appropriate distancing between people, assuring that frequent contact surfaces are cleaned very regularly, assuring that all the people that a patient interacts with when they enter an office are suitably protected with the right PPE, not just for their own protection, but to make sure they don't spread any kind of germ to the person walking into the office. And you know, all of those things have worked. They've worked beautifully. We have had a resoundingly successful effort there. And I am now 1000% positive that if you need to see your care provider, you can come in and have a person-to-person visit with no undue concern about getting sick. On the other hand, we have mounting evidence that delaying care, deferring those visits, stopping your medications, stopping your healthy habits, those have very serious consequences, very dire consequences. I just, again, reviewed an article this morning, again, during my reading hour, a report from the Society for Thoracic Surgeons. This is a big agency that tracks cardiac surgery in America and outside America as well. This report indicated that during the pandemic months of 2020, we saw a reduction of more than 50% in cardiac surgery caseload. Well, you might think, well, maybe that was appropriate. Maybe some of those were cases that could be safely delayed, and we wouldn't want to bring somebody in a hospital unnecessarily during the pandemic. There was some of that, but most of the work done during those months was urgent work that could not be delayed, and yet still we saw big reductions. Furthermore, we saw that the risk of dying during your hospitalization, the hospitalization in which you received your operation, more than doubled. Now, does that mean that hospitals just forgot how to do safe heart surgery during the pandemic? No, it doesn't. What it means is that, sadly, there were impediments to delivering healthcare in the usual way because of the pandemic. In some cases, people delayed their care so that by the time they did present for care, and it was recognized that, golly, this person needs a heart operation right away, they had already been injured from their heart disease, which had not received the care it required. That made their care more complicated, increased the risk of a bad outcome. And Megan, that's just one example. I could give you many in the cardiovascular world, many case examples or types of procedures that were delayed or deferred. In most cases because people were concerned about the safety of their care, and it had bad consequences for people. So, as I said before, the number one message is, please stay connected to your care provider. We have opportunities for you to do that virtually now if you are inclined to pursue that sort of interaction. But however you manage it, please don't stop taking your medications. Please don't stop connecting to your care provider.
And while we're on the topic of connecting with care, what if there's someone watching, has no idea they may or may not have a heart issue, but just feels like something is wrong? What symptoms should they be looking for that would then result in them going to the emergency department and seeking that care?
Right. So the classic symptoms of heart and vascular disease, we've tried to advertise widely so that people would be aware, but it's worth repeating that for heart trouble particularly, cardiovascular problem, heart problems specifically, most commonly present with some kind of change in your tolerance of exertion. Sometimes for people who are fit and say they jog regularly and so forth, they may just notice that they don't have quite the endurance they had. They don't have the speed they had. Maybe they tire out more quickly. For many people, though, it's a little more dramatic. They may recognize that they get chest discomfort or trouble breathing just walking up a flight of stairs suddenly, and this is something new. In acute cases, that is, things that are really ramping up out of control, there can be symptoms at rest, where you feel shortness of breath, chest pain, pain radiating into your arm, sweatiness. If those things happen while you're just sitting back, relaxing, watching television or something, that's a really serious sign. You could be walking right up to a heart attack. Those people should not delay at all. They should call 911. They should be taken immediately into a medical aid unit or an emergency department and evaluated to assure that they're safe. For those people that experience less acute limitations of the type I described, they don't have to race into an emergency room, but they do need to have an evaluation done promptly. They should communicate with their usual care provider, discuss the symptoms they're feeling, let their healthcare provider direct their care.
Absolutely. And as you've mentioned, it is safe to receive all types of care at ChristianaCare. So please do not hesitate to reach out to us for any of your needs. Dr. Garratt, before I let you go, how can anyone, health condition, no health condition, no matter the age, keep themselves heart healthy during this pandemic? We're now coming up to a year. A lot of people, we're not leaving our homes as much. We're not maybe exercising as much because we're trying to stay safe at home. What can we do to keep being heart healthy while being COVID safe and everything else that's going on?
Well, the answers are the usual ones, to tell you the truth, Megan. We want people to continue to make good life choices. This is not a good time to take up smoking, although I can understand how anxiety may make people think that's a good idea. It's not a good idea. Certainly the heart and vascular consequences of cigarette smoke are now well established. So if you don't smoke, please don't start. If you do smoke, this is an excellent time to find creative ways to kick the habit. It will serve you very well. Exercise. I emphasize this with my patients over and over. They're probably sick of hearing me say it. Exercise doesn't mean you have to get on a treadmill for an hour every evening. Exercise means you need to remain active. You need to get out of your chair, off your sofa. You don't want to come home after sitting at a desk for 8 hours and plop in front of a television for 4 hours. That ruins your metabolism. We're built to be in motion. We're meant to be chasing down our dinner at night. We're meant to be really active. And if we can just build in habits of taking walks, going for a bike ride when the weather is good, swimming, whatever you like to do, just do it on a regular basis. You don't have to do it to exhaustion. You don't have to do it until you feel terrible. Just get your heart rate up. Get your lungs and your heart working a little more for you. It's magic for your metabolism. It will really put your metabolism on the right footing. So that's very important. The diet thing, it's a hard time to have the diet conversation with people, Megan. You're sitting at home now, you're trapped, you can't go out. We have actually seen some good stories there, because some people who during the pandemic realized they're eating a lot of fast food, they're eating out a lot, they're taking in a lot of unnecessary calories and processed and kind of fried foods and the like. And some people have discovered the joys of preparing food at home. Yeah. That's really terrific. If you're not in that camp, all I can tell you is that to the degree that you can limit the high fat, high calorie, high sugar foods with low nutritional value, you'll not only be doing your heart and vascular system a big favor, but your whole body. We know that those things are linked to lots and lots of diseases. So really a good thing to take seriously. But certainly staying on top of your numbers, we've talked about that a lot, and this is directly a consequence of staying connected with your healthcare providers. Ask your healthcare provider for your cholesterol numbers. Ask about your sugar. Ask about your triglycerides. These are things that can help you be informed about your risk and help you make wise decisions about sustaining your health. And then again, the last thing that I guess I mentioned it earlier once before, don't stop taking your medications. Nobody likes taking pills. I haven't met one patient yet who's been thrilled about their pills. But remember that the medications that we're able to offer you today have proven their merit. They've extended lives. They've allowed people to lead more active lives, longer, healthier lives. It's meant the difference between being committed to a rocking chair and watching your grandkids play on the floor when you're 70 versus watching your grandkids play on the floor and then getting up with your own kids and going playing 18 holes of golf. It's a different life that we can enjoy now. And medications are making that possible, along with these other lifestyle choices and other things that I touched on. So please don't stop taking your medications. Stay focused on your health.
And what about how does mental health factor in? Mental health has been a serious conversation, especially during the pandemic. Is there a connection with mental and heart health at all? Sure.
I'm glad you brought it up, because it's a part of cardiovascular care that we sometimes overlook. And the pandemic has reminded us of how critical this connection is. what we refer to as your affect, the way you kind of experience your world is hugely impactful. And I won't torture you with all the fascinating science behind this, but I can guarantee you that clinician scientists who are interested in this area have gone a long way in helping us understand, how does that work? How is it that just feeling a little blue or off today, or missing my loved ones or my friendship network, how is it that leads to a heart attack? I mean, how does that happen? Well, it's abundantly clear now that the way our bodies are built allows that to happen. I guess I'll leave it there. So yeah, we as healthcare providers, as healthcare teams, we have to pay attention to this. In the Center for Heart and Vascular Health at ChristianaCare, for example, we have embedded behavioral health experts into our care teams so that we have access to the resources we need to take optimal care of folks. I'm a cardiologist. I feel very comfortable with my skills in managing heart and vascular problems. Behavioral health matters are not really my area of expertise, even though I understand how they interact with my scope of practice. So you can imagine how useful it is then to have a partner right there, right next door, that I can pull in quickly to a conversation about patient care, facilitates tending to those issues. For the folks at home, I don't know that I have a magic bullet, but I do think it's worth emphasizing that addressing your feelings and addressing how you're managing during this pandemic, particularly now that it's become a marathon, nearly a year in duration, is really critical to your care. Don't just worry about your risk of heart attack or stroke or something today in the abstract. Think of it in a holistic manner. Remember that your mood and how you're feeling can have a powerful impact. Get help if you need that.
Absolutely. Thank you for touching on that. And if someone watching is looking for more information or specifically about their own risk for their heart health, where can they go?
Well, I recommend people go to ChristianaCare.org/heart. That will land you on our Center for Heart and Vascular Health webpage. Lots of different resources and interesting things to find there, including a spot you'll be able to click on that will take you to a heart risk calculator. Ask you a few personal questions about your age, your gender, and some health questions. None of that is trapped or followed or captured. It goes back into the ether as soon as you push a button. But it will allow the machine to calculate your risk of having an unwanted heart or vascular event in years ahead. I find that's helpful for some people. Sometimes it's that extra little push people need to make a decision that they are going to engage with a provider and get ahead of their healthcare risk, make sure they don't have a problem.
That's great. And if anyone's looking for that, ChristianaCare.org/health or /heart, excuse me, and it's the heart risk assessment on the website, and we'll put that link in the comments to this video as well. Dr. Garratt, thank you so much for joining us. I'm sure we will see you again soon. This won't be the last time we talk about this topic specifically. Happy Heart Month, and we'll see you soon.
Happy Heart Month.